Tonight we are digging into mental health in Oklahoma.
I want to start with a breakdown of the numbers from the National Alliance on Mental Health. Take a look at this. At least 592,000 adults in the Sooner State have a mental health condition. Now, to put that in perspective, that's 4 times more than the population of Norman. For 152,000, their condition considered serious. As for kids ages 12 to 17, 58,000 were found to have depression. Now, improving mental health care a major focus right now. It's a cause that brought more than 1,000 Oklahomans to Norman.
For the first time ever, registration sold out at a conference held by the Department of Mental Health and Substance Abuse Services. Fox 25's David Chasanoff was there. So, David, was it really that crowded?
Adam, Wendy, you bet it was, though you can't see much right now, of course, because sessions have wrapped up for the day. We're here at Embassy Suites Hotel. We stopped by one of these breakout session rooms. The seats were all full, so some people had to be standing for this event. Now, some people tell me because of the subject matter of mental health, this was a good problem to have. More than 1,000 healthcare workers gathered in Norman Wednesday for day one of the Momentum Conference.
This conference is huge.
The 3-day event offers 70 breakout sessions.
I didn't have a waiting room.
People left those presentations saying they've already learned a lot about things like self-care.
You can't pour out if you don't have anything to pour, and so really take breaks, focus on your mental health, make sure you're staying positive.
It was really informative, just looking at ways that we can empower youth to, help us build a future so it's not solely dependent on us.
This event has been around for more than 20 years, and it's the first time it's ever sold out. Kurt Rawls with ODMH SAS tells me it's showing how people are becoming more interested in mental health.
The namesake of the conference, lots of momentum happening in the building. Post-pandemic, mental health care in general has reached, a higher caliber of need and value, and people see that, and we want to support it.
Our lives are full of unwritten rules.
I think it just speaks to the heart that we have here in Oklahoma, and that more and more people are recognizing the need for mental health and prevention, and it's just reassuring to see that this many people really care about it and want to make the state better.
Definitely encouraging to see the turnout. Day 2 of the conference begins tomorrow at 9 a.m., and I'm told the event runs through Friday. Reporting live in Norman, David Chasanoff, Fox 25 News.
David, thank you. Oklahoma City seeing a 57% decline in police officers being dispatched to mental health related calls. As Fox 25's Paige Taylor explains, the state's mental health commissioner believes this shows the 988 lifeline is working exactly how it's supposed to.
Mental health related calls dispatched to Oklahoma City police officers have dropped by nearly 60%. The Oklahoma Department of Mental Health and Substance Abuse Services reports in October of last year, officers were dispatched to 1,292 calls. This October, that number shrunk to 549 calls. Mental Health Commissioner Ali Friesen says this means Oklahomans are utilizing the 988 lifeline.
So it takes some time, obviously, for the general public to understand what this is and when to call and what kind of action or lack of action to expect. But this is exactly what we want to be seeing, is that we're decreasing the pressure on law enforcement and we're decreasing the need for them to respond.
Friesen says the level of care and experience for someone having a mental health crisis will differ based on who responds.
So there's a certain, of course, very specific need for law enforcement in some potentially dangerous or clearly dangerous situations. But when an individual is in a mental health crisis or on the brink of a mental health crisis, having an individual that's trained and licensed and can support you through that process is a whole different game.
Oklahoma City Police Chief Ron Basie says responding to less of these calls frees officers up for other priority calls and city needs.
We took 1.4 million 911 calls last year. And so there's definitely a need for response, and just being able to prioritize those is important for the officers and the community as well.
Chief Basie says officers receive crisis intervention training while they are in the academy, but through resources like 988, Oklahomans can be connected with the help they need from mental health professionals.
Now, obviously, if you call 911, we have the ability to redirect it to the appropriate resource, but the fact that 57% of those calls were decreased that were dispatched to officers is amazing. It's not to say that we won't ever need police officers on crisis calls, because there are certainly those circumstances that require it. But when it doesn't, those resources are there, and they're starting to grow, and we're really excited about that.
Paige Taylor, Fox 25 News.
From October of last year to October of this year, the Department of Mental Health reports call volume is up by 79% in Oklahoma County, which the department says means more people are gaining awareness of 988.
The Oklahoma City Police Department continuing to tackle the issue of mental health in Oklahoma through its crisis intervention team. It's a community effort bringing police officers and the community to find solutions and services to individuals dealing with mental illness.
It's a team of officers who have a propensity in de-escalation tools by slowing things down and helping people work through crisis when it's in an emergency situation. This is a team of officers who've gotten their specialized training, and they're willing to take the time necessary to help people through that process.
According to the city's progress report from July, the department established a program in 2002 to improve crisis response and advocate for mental health services, and as of June, the program has more than 170 members. Back in February, the city implemented a mental health quality assurance program to assess the effectiveness and safety of all police interactions with people experiencing a mental health crisis. Now, over the years, we've seen the police department continue to find new techniques and resources to better serve Oklahomans. This includes utilizing iPads to directly connect mental health experts with people in crisis. Here's a full breakdown on how those work.
We can contact Hope, Red Rock, or North Care to speak to a mental health provider. We call the provider, give them a brief description of what is going on, hand the iPad to the person in crisis, and they can have a conversation. We will usually step back to allow privacy.
We're told that the provider can often resolve the crisis and connect the person with resources, and while sometimes they recommend the person receive a higher level of care. In the beginning, this initiative started off small, but the program continued to grow. Last year, the department started issuing out the iPads to non-CIT officers. The city of Oklahoma City also investing in programs that will allow the fire department to help people in crisis. This includes a crisis call diversion unit and a crisis response team. The diversion unit will add mental health professionals to 911 calls. These programs set to track mental health encounters and identify trends, as well as develop innovative methods to resolve interactions with people in a crisis and find best practices for mental health response across city services.
The University of Science and Arts of Oklahoma is expanding its mental health services for its students. This week, the university welcomed Christy Trapp as a full-time counselor. Trapp has extensive experience and knowledge in mental health care, and in this position, she'll oversee campus counseling services and develop innovative initiatives that are aimed to improve mental health resources and accessibility across campus. The Care Center, Oklahoma County's only child advocacy center, is introducing their first therapy dog. This is to help children who've experienced abuse.
Fox 25's Katie Arata met with a therapist and therapy dog at the center today, walks us through the benefits this resource will provide.
So Poppy is our first therapy dog that we have gotten here at the Care Center, and we are very excited about getting her trained to do this.
The Care Center is an Oklahoma County nonprofit child advocacy center that exists to reduce trauma for child abuse victims and their families.
Our really mission is to prevent child abuse and provide opportunities for healing and hope in Oklahoma County. And we do that through a variety of ways.
One way the center helps children process their trauma and heal after abuse is through mental health support or therapy. And for the first time, the center is introducing a therapy dog to help children feel less anxious as they navigate through therapy.
It provides a really great icebreaker for kids when they start therapy to have a dog around. It's a really good way to build rapport with the kids. And it also just makes therapy a little bit more fun and enjoyable as they go through that process.
The comforting presence of therapy dogs like Poppy here create a safe space for children to express themselves.
And the really goal for her is to provide comfort and support for kids that we see through our program here who've experienced abuse and neglect, and also provide a support with regulation and just comfort as they process through their trauma.
Poppy is still a puppy, but once she gets a little older and some therapy dog training under her belt, she'll be ready to comfort and support children at the Care Center. Reporting in Oklahoma City, Katie Arata, Fox 25 News.
Mental health treatment in jail has also been a major topic of discussion, both nationally and in Oklahoma. The National Alliance on Mental Health found 1 in 4 people with a serious mental illness has been arrested at some point in their lifetime. The organization also noted about 2 in 5 adults in jail or prison have a history of mental illness. Oklahoma lawmakers explored the issue of jails being used as mental health facilities back in October during an interim study.
Right now, we only have one institution that services individuals who have mental incapacity, and that's Veneta. We've got to make sure Veneta is properly funded. We've got to make sure there's more beds available. There's a crisis that's taking place right now as far as bed space. So we have to make sure there's other facilities that we can use to service that population. I think more access to diversion courts, more access to rehabilitation programs, and making sure that officers get the proper training, making sure that they don't just arrest people who are in crisis, get them into a facility, get them the treatment that they need.
Last year, a federal lawsuit known as Briggs v. Friesman was filed, alleged there were unconstitutional delays that violated the rights of several defendants who had been declared incompetent to stand trial or being held in county jails for months while their cases remained on hold. Last month, it was announced a settlement had been announced. However, the details were not released, but both the governor and the attorney general noted the deal would resolve the issues in the lawsuit without costing taxpayers millions of dollars.
Despite the focus on mental health efforts, the Department of Mental Health has paused several promotional campaigns that were aimed at saving lives. This decision came as a former longtime employee with the agency was charged with embezzlement. We told you back in September, the agency slammed the brakes on every outside contract that had been overseen by that former employee, Heath Hayes. This includes spending to promote 988 and the Tough as a Mother campaign for moms facing addiction. The agency's commissioner, Ali Friesen, told us at the time that the focus is on doing what is right for the people of Oklahoma by prioritizing patient care and maximizing the responsible use of taxpayer dollars. And that was your big story breakdown tonight. You can find our full investigation into the mental health campaign pause, plus the efforts being made to address mental health and mental illness in the state on OKCFox.com.